Assalamu alaikum, this is Dr. Hasna with Hasna's Anatomy, here to make all your anatomy concepts a piece of cake. So do not forget to subscribe to my channel and turn your post notifications on. Today we're going to discuss the lumbar vertebra, a part of your spine on the lumbar area, which is basically lying behind abdomen. So that part of the spine which has these little guys right there, we are going to be nailing this topic today. So keep watching and do not forget to watch till the end. I've got some really cool tricks up my sleeve. Let's get started with the topic. Whenever we talk about any vertebra, I'm going to assume that you guys have no clue what a vertebra is. It's basically a part of your spine, individual bone of the spine. We have cervical, we have thoracic, we have lumbar, and then we have sacral. Now, sacral vertebra, they're all fused together, and therefore they overall form this bone called the sacrum, and below them is the coccyx. All right, so that's basically how your vertebra runs. Now, in the center of all the vertebrae, you'll see this foramen-like thing. It's called the vertebral canal. Now, this vertebral canal all together is going to extend from top to below, and this is going to carry your spinal cord, which is an extension of the brain. Makes complete sense. Here's the deal, guys. For every vertebra, I want you to remember this basic structure. It has a body in the center, then it has this pedicle. The pedicle is the starting of the vertebral arch. Foramen, or this vertebral canal, we need to surround it with something. So we're going to surround it by the vertebral arch. So the pedicles are what emerge from the body, and the pedicles posteriorly, these become the laminas. And once the laminas end, they join to form the spine. So there's a spinous process. Anything that projects from any part of your bone or any structure is known as a process. Since they have a tail, they also have wings. I know that's quite surprising, a bird with a tail. Let's just consider these guys a little bit unique. These wings are known as transverse processes. I hope you can remember that. Not just do they have transverse processes, because with transverse processes, their wings are gonna get a little weak. They also have these projecting parts, so one that projects above. These are known as the superior articular process. These are basically processes projecting above from this vertebral arch. And then they have a process below. These are known as the inferior articular process. These are basically for the sole purpose of communicating with the vertebra above and below. These have these facets that are going to form joints, intervertebral joints with the vertebra above and the vertebra below. That makes complete sense. Therefore, when you look at a vertebra, they form this weird old species that has a tail and wings. The wings are even enlarged because of these superior and inferior articular processes. So from here, I'm going to take the base of that and talk about the lumbar vertebra. Now, the lumbar vertebra too has a body, as you can see right here. The body is specialized, has some differences from the other vertebra. Like the other vertebrae are not as big as this is. Lumbar vertebra, they are usually big, all right? And they're like 5 lumbar vertebrae. All these lumbar vertebrae are larger in size than the thoracic and cervical vertebrae, all right? Secondly, they have this canal. This canal is actually larger than the thoracic vertebrae canal. However, smaller than the cervical vertebra canal, and cervical vertebrae have bigger canals, and that is because the spinal cord is actually thicker above and then it starts tapering. Apart from that, they do not have any costal facets like the thoracic vertebra have, because the costal facets in the thoracic vertebra are for the purpose of articulating with those ribs, right? So the lumbar vertebra, basically they forget they don't have ribs. They, for a while, they actually start constructing ribs, and when they start constructing ribs, they form these transverse processes by their costal elements, and then all of a sudden they remember, oh my god, 1 second, I'm a part of the abdomen, why the heck would I have ribs? So it stops processing the ribs, but its original transverse process is going to project from the posterior-inferior part of these transverse processes as the accessory transverse process. So basically, this accessory transverse process is the OG transverse process. These transverse processes that we call the transverse process are actually what they were about to form the rib. So now let's talk about the body of the lumbar vertebra. Overall, I want you to remember that the lumbar vertebrae are 5 in numbers. Among them, the 4 are typical and the L5 vertebra is atypical, all right? Let's talk about a typical vertebra. This is L1, L2, L3, L4. Any vertebra would look like this, all right? So it'll have a body. Now, the body of the lumbar vertebra is anteriorly has a greater height than posteriorly, and this is for the sole purpose of the fact that your spine is supposed to be like, you know, curved, right? So for that curving situation, the lumbar vertebra is like, honey, I need to do something about it, right? So therefore the lumbar vertebra provides that by having a larger anterior height than a posterior height of its body. Makes complete sense. Now let's move back. These are the pedicles of the vertebra. The pedicles are basically going to be more above than below, so they have this inferior notch that is formed. Then going even posteriorly, you'll see these 2 projections. This is the transverse process. Now I want you to remember this one little tiny part that you shouldn't forget, and that is that interior surface of this transverse process has a vertical ridge. it has a lot of significance. Remember that. I'll ask you if you remember. Posterior inferior to the transverse process I've already talked about is the accessory transverse process. Now projecting superiorly is this process right here. This is the superior articular process. Now the superior articular process consists of these facets that is going to communicate with the vertebra above. It's inferior articular process. Then we have the lamina. This is the lamina, which is quite broad and it's flat, right? The flat broad lamina, from it downwards projects your inferior articular process. Now this also has these facets to articulate with the superior articular process of vertebra below. Even going posteriorly is this short broad spine that we have of the lumbar vertebra, and that's how we come to an end. The spine is thickened posteriorly, inferiorly. I guess that's enough for the bony features of the lumbar vertebra. L5 vertebra, which is an atypical vertebra, has a couple of different features. It is the largest of all the vertebras, also because as we go down L1 to L5, the vertebra size keeps getting larger. The L5 vertebra will be short and thick, more like pyramidal in shape. And finally, I want you to remember that in a typical vertebra, the superior articular process, distance between them is more than the distance between the two inferior articular processes, which in the case of the L5 vertebra is going to be almost equal between the two. So how about we learn the attachments of a lumbar vertebra together? Let's draw. What do you see first? A body. All right, makes sense. Then come the pedicles. From the pedicles, we have this projection called the transverse process. Kind of made it a little too long. Let's just cut that short. What did I tell you was present over here? A vertical ridge. Then come behind the lamina and we go all the way to the spine of the vertebra. Same is happening on this side, and you can see literally looks like a superhero, but it's just a lumbar vertebra. It just has to carry the function of keeping a spinal cord protected, right? So let's keep it at that. And then in the center, we have this vertebral canal. All right. Now I want you to remember for the attachments, they're quite easy. All right. All you have to do is draw an anterior longitudinal ligament in front and an anterior longitudinal ligament behind. All that happens is the anterior longitudinal ligament is attached to the upper and lower borders of the anterior side, and posterior longitudinal ligament on the upper and lower borders of the posterior side. How easy was that? There's this thing called the diaphragm, right? And these are the L1, L2, L3, L4, L5 vertebra, right? Diaphragm had crus, right? The right crus and the left crus, or the crura in plural. Right crus would go and attach right there, and the left crus would go till L2. Now the right crus is attached to L1, L2, L3, and left crus is attached to L1 and L2. Therefore, if we draw it towards the left side, only the L1 and L2 vertebra will bear attachment of the crus of the diaphragm. Whereas on the right side, L1, L2, L3 vertebra are going to be bearing the attachment of the right crus of the diaphragm. This area right here is for the intervertebral disc between all the consecutive vertebra. Talk about the various muscles of the back. Now we've already discussed the muscle of the back. Most medial to lateral, what muscles come? The first medial most muscle comes is the psoas major. I'm sure you remember. So the psoas major is what was originating from this area, right? This vertical ridge is now going to be that important landmark. Medial to this vertical ridge is the entire transverse process giving origin to your psoas major muscle. Covering the psoas major muscle is the psoas fascia. Makes complete sense. I mean, there's no rocket science over there, but the rocket science is about to begin. Lateral to this vertical ridge is going to be our muscle of the back. This is the quadratus lumborum. Extends a little bit laterally. Posterior to the transverse process, I want you to draw two muscles. One is the multifidus, and the second is the very important erector spinae muscle. I want you to bear three attachment points in your mind. This point, which is the vertical ridge, the tip of the transverse process, and the tip of the spine. What's going to be attached over here? None other than the thoracolumbar fascia. That infamous fascia that was just everywhere whenever we tried to study a book of the abdomen. Now this is where it's arising from medially. The thoracolumbar fascia has three layers: anterior, posterior, and middle. The anterior layer is what arises from the vertical ridge of the transverse process, and when it arises from the vertical ridge, it will cover the quadratus lumborum muscle, and there it goes and blends laterally. Next we have the middle layer. The middle layer will originate from the tip of the transverse process, and this goes laterally, blends with the anterior layer. Anterior and middle layer of the thoracolumbar fascia have actually completely covered our quadratus lumborum muscle. Then we have this layer called the posterior layer, which is the thickest, and this posterior layer is responsible for going all the way into the thorax. This is what comes from the spinous process of the vertebra, and this goes all the way, covers your erector spinae muscle, and it goes and blends with laterally the other layers of the thoracolumbar fascia. If I ever cut open through someone's back wall, posterior abdominal wall, the first thing I'll see is skin, superficial fascia. What will I see next? That is the posterior layer of the thoracolumbar fascia, then the erector spinae, then the middle layer, then the quadratus lumborum, anterior layer, and finally we get to the kidneys or whatever organ you're looking for. Like, how am I supposed to know what you're looking for? And we have a interspinous ligament. I mean, how hard is that to remember? So I believe that these attachments for the lumbar vertebra are enough. All you need to know is this diagram, a little bit concept into it, and you can easily talk about what attachments lie on the lumbar vertebra. This is the only memory I have. Let me try to put it over here. So suppose the Viva examiner is looking directly at me and I'm just like, hello, hi, let me just tell you what a lumbar vertebra looks like. Are anterior to the body, on the upper and lower border is the anterior longitudinal ligament, posteriorly is the upper and lower border, the posterior longitudinal ligament. This area on the side of the body and the anterior part of the transverse process, medial to the vertical ridge, we have the psoas major covered by the psoas fascia. On the vertical ridge, we have attachment of the anterior layer of the thoracolumbar fascia. On the tip of the transverse process, attachment of middle layer of the thoracolumbar fascia. On the spinous process is the posterior layer of thoracolumbar fascia. Now about the muscles, the quadratus lumborum is going to come from the anterior surface of the transverse process lateral to the vertical ridge. Literally all the things that I have studied with concept, I'm just putting them into words. And anatomy is only a game of description. And posteriorly is the attachment multifidus muscle, erector spinae, and interspinous ligament on the spines. If I want, I can talk about the diaphragm, the left and right crus also attached over here, and there you have it. I mean, I don't know why we were looking at the books, flipping through the pages and going like, oh my god, this is gonna take ages. So that was all you needed to know for the lumbar vertebrae. I really hope you understood the concept. Thank you so much for watching, and I'm about to sign off.